Hi, everyone. My name is Katie Gourlay, and I'm a third year medical student at the University of Alberta. Pain is a common reason children seek medical care, and for children, treating pain is essential for improving a child's quality of life. Pain affects everything in a child's life. It affects their ability to sleep, play, eat, the way they interact with the world. We look to medications often to solve this problem, but which medication should we be using? How can we treat childhood pain best? Every pain medication is effective to a certain extent, but each one has its own adverse event profile, commonly known as side effects. We can think about effectiveness and adverse events like two weights on opposite ends of a balance. If the side effects are too intense, it doesn't matter how great the drug is, the side effects will outweigh the effectiveness of it. Our study is comparing two balances, ibuprofen and oxycodone. The drugs are two common options for treating pain in children, and they've actually been shown to work similarly well. So, to find out which is the better drug, we need to know what causes the most frequent and the most intense side effects. To answer this question, we recruited 4 to 16-year-olds to a study in the emergency department who had a limb fracture and who took either one of these medications on day one after their fracture. We followed them for 3 days and compared the frequency and intensity of 8 common adverse events: nausea, vomiting, dizziness, drowsiness, constipation, abdominal pain, appetite loss, and rash. We also looked at 4 core functions: the ability of a child to eat, play, sleep, and attend school. And we compared whether or not ibuprofen and oxycodone affected each of these. We showed that oxycodone more frequently reported drowsiness, nausea, vomiting, dizziness, and constipation. What's equally interesting is that children taking oxycodone reported a higher intensity of abdominal pain and constipation. Next, we compared functional outcomes by medication and fracture type. In children with upper limb injuries, analgesia choice mattered. So, playing and attending school was more difficult if they were taking oxycodone. However, in the lower limb group, there was actually no difference between medication types, and a significant proportion of children experienced impairment in all 4 function types, regardless of medication prescribed. Treatment of pain matters, and studies like these can help healthcare workers find optimal analgesic options for children. We need more studies comparing the adverse event profiles of common pain medications. Studies don't usually include adverse event intensity in their comparisons, but our research team thinks that they should. If we can get a better understanding of the human experience of taking these medications, then in the long run, we'll be able to find the drugs that can help us treat childhood pain best. Thank you.